My name is Linda Kurtz, and I am a student at Union Presbyterian Seminary in Richmond, Virginia. This past summer, I completed an intensive unit of clinical pastoral education in Charlotte. Like many others who have done CPE, I spent 12 weeks in a hospital setting, learning about chaplaincy and developing my identity as a pastoral caregiver. Like many others, I wanted to have all the right answers to fix people's crises of faith, and I had to learn that that's not the point of chaplaincy. But unlike many others, my CP unit took place in a behavioral health hospital. My patients didn't have cancer or need surgery. Instead, my patients had depression, anxiety, and bipolar disorder. Certainly, they had experienced trauma, but it wasn't the kind I could see. My patients were some of the 1 in 5 adults in the U.S. who experience mental illness in a given year. Only 41% of those adults received mental health services in the past year. My patients were some of the 1 in 5 youth who experience a severe mental disorder at some point during their lives. Only 50% of them received mental health services in the last year. What I didn't know prior to my CPE experience is how many people of faith fear that God has abandoned them in the throes of their mental health crisis. I didn't realize how many people believed that the devil had taken over their minds because they didn't know what else to think. And I certainly didn't realize prior to my summer in Charlotte just how unwelcoming our churches can be to individuals with mental health conditions, probably because we just don't know how to be welcoming in the first place. So let's talk about it. Let's talk about how our theology can embrace mental illness, not cast out those who experience it. Let's talk about churches making a difference for the people in their communities impacted by mental health. Let's share some resources for your own context and ministry. And by the end of my Ignite presentation, I'd like you to think about this. May is Mental Health Awareness Month. What might you do in your context to acknowledge this? How might you use this opportunity to make the place where you serve a place that serves people with mental illness?